So the dynamic duo, literally doing what is called a fluoroscopy procedure, right? All right, so let's roll the tape, and Ralph, if you can kind of walk us through what's going on.
Sure. So here, basically, the patient's already on the table. We've already prepped the patient in a sterile fashion, and I'm just here bringing in this biplane that I was talking about. So as you see, it looks like two giant C's. That one that's on the top basically allows us to see the patient from the front to back, and then the one that's coming in on the side, that's the one that gives us that side-to-side view. If you take a look there at that monitor, you see that we have a couple of images and a couple of things going on there. We have our vital signs, we have our AP and lateral views. We could also bring in MRI images up there and show them. So then here, Dr. Mena and I are just kind of talking about how it is that we're gonna go about and do this procedure. What's the idea? We're calling timeout right now here. It's always done before any procedure, just to make sure that we have the right patient, right procedure on the table, ready to go.
And Ralph, is the patient awake?
Patient is awake. However, we do give that local anesthetic.
Okay.
Like Dr. Mena was explaining earlier, it takes about 2 to 3 seconds for it to take effect. So honestly, the patient shouldn't feel anything. If they do, we always go ahead and give more. We're not stingy on our lidocaine, so you know that helps. So here is is an image of Dr. Mena just administering the lidocaine, and I'm handing him his very fine, small needles that he goes ahead and inserts into the area of interest. And at the same time, as I was saying earlier, I manipulate the image for him to see his guidance, basically, to make sure that he's getting in where he needs to go with these needles. I don't know if you could also notice that we're wearing quite a bit of things there. That's basically just for our own protection.
Of course.
And obviously the patient's protection as well. So we have
right now, what is the doctor doing there?
Right there, he's administering the
medication?
The medication, which is basically the steroid, to go ahead and alleviate the patient's pain. Now he's just making sure that the patient felt the medication going in, because that's actually a sign or an indication for us to know that the medication actually went in where it needed to. Because on top of the whole radiographic imaging that I provide for him and knowing that we're in the right spot, we also confirm with the patient that they're feeling, you know, the medication going in or whatnot. So it alleviates the pain.